Good morning. It is January 28th. It is the first morning after surgery. Yesterday after coming home, and last night until about 1 a.m., I still had a lot of the IV drugs in my system. It was still, a bit of the anesthesia. So my pain stayed pretty tolerable, or, just so minimal, until about 1 a.m. I am a stomach sleeper, or, on my side, and obviously I can't do that right now with all the incisions. So I was sleeping on my back, and I didn't move around a whole lot. So I was quite sore. I still have some of the gas that was pumped into my abdomen trapped. I can feel it in my rib cage and then up around my shoulder and around my neck. So that's pretty uncomfortable. And then about 1 a.m., aside from the gas, I started feeling the incisions, particularly the one right by my navel, and then the internal vaginal cuff where that stitch closed. I could feel those incisions kind of stinging, burning, and just movement, especially certain positions. If I did roll a little bit on my side or trying to get out of the bed, I could really feel them pulling and kind of burning and stinging, especially that center one there. Again, not easy, but it's tolerable, but not the most comfortable thing to experience. I was given Oxy for the next several days to take that. I have been taking that every few hours, but even this doesn't take the edge off, obviously, as well as the IV drugs they were giving me. So I am a bit uncomfortable today. I was uncomfortable last night, but I'm doing okay. I'm still eating, drinking. This morning I made myself some steel cut oats, and I'm on my second cup of coffee. I did add some Miralax powder to my first cup of coffee because I have not gone to the bathroom yet, and if I get to day 4 without being able to have a bowel movement, I'll have to go back to the hospital. So, hopefully things will start moving again like normal in the next couple of days. I know I talked a little bit about what I was having done, so I just want to explain that a little bit further. So I had a total laparoscopic hysterectomy with a bilateral, still can't remember that term, but basically the total hysterectomy is when your cervix and your uterus is removed. The additional taking my fallopian tubes out, that has another medical name for it. So I had my cervix, my uterus, and my fallopian tubes removed yesterday. And I think I mentioned this yesterday when I got home. Everything, even though I haven't been able to talk specifically to my doctor yet, everything went as planned, and my ovaries are still intact, which was extremely important to my medical team and me as well, to keep hormones flowing in my body. So I'm happy about that, and from my understanding, they did not find any endometriosis. Again, I have not spoken to my doctor or surgeon yet. I will have a follow-up in a month, and I can hopefully get some in-depth detail about the condition of the organs that they did remove and all of that. I have pictures but zero explanation for, I mean, I kind of know what I'm looking at, but it looks like kind of like, you know, time that during surgery, what it looked like going in and then removing everything, you know, what it looked like after. So, but I don't know exactly, you know, what they saw or what the condition was. So just have to wait until my follow-up appointment in a month. So I am walking around okay. I do feel the pull on the incisions much more today. So I tried to lift some glass bowls from an upper cabinet yesterday to help cook dinner, and I could immediately feel the pull and pain there in that navel and the internal incision. So I stopped and asked my husband to get those bowls down. So I know I'm not supposed to lift more than 5 or 10 pounds in the next couple of weeks, but nobody thinks, you know, it's like it's a bowl, a couple of bowls. But yeah, it definitely pulled on everything. So I really have to restrict how far I try to push myself, because I'm not one to sit still or go about my daily life doing things, you know, cooking and cleaning and things like that. But I'm just going to have to be very mindful of that so that I don't further cause any of those incisions to open up, especially that internal one. So since they did remove everything in between my ovaries down to the top of my vaginal canal, that's like open space in there now where the uterus and the cervix and the fallopian tubes were, and your intestines, you know, will settle into that void in your body. So on top of the painkillers, IV meds, and just the stress of surgery, and now my intestines are, you know, repositioning themselves. You know, a bowel movement can be, you know, where you may be regular forever, you know, you don't have any issues. It puts a lot of stress on your body. So, plus I'm kind of scared. I've went diving up probably a little too deep online before my surgery and heard some horror stories that even, you know, years later, that vaginal cuff that they create there at the top of the vaginal canal, they sew it shut. So you're just not just completely open. All your organs aren't completely open. But, you know, pressure can cause that incision or that cuff to tear and open up, and your intestines be out on the floor. And so, yeah, it's a little in the back of my mind there. You know, I know any woman that's ever given childbirth, vaginal, you know, delivery, has the same kind of worry about what it's going to be like the first go after. So yeah, I definitely don't want my insides to come tumbling out. So we'll see how that goes. I'll definitely update you and try to leave out too much of unnecessary information. But later on, when we get to that point, I do plan on discussing the sex side of things, because I know, I mean, that's scary. It just is. It's scary because I have, you know, that they create that vaginal cuff at the top, and, you know, there's a lot of things that, you know, go along with that is it just through your mind thinking, you know, what's sex for the first time going to be like? Is it going to be different? Is it going to hurt? You know, and then you're worried about your body parts falling out if that tears and comes open. So I will in later videos cover that. That's going to be one of those things that are, you know, embarrassing probably to talk about, or for some people TMI, you know, and that's fine. You know, I'll make sure that I label the video so you know that that's going to be in there before you watch it, in case you're not interested in, or, you know, whatever, you just don't want to hear about it. But I am going to cover that because that was obviously one of my very first concerns, and I had a lot of questions about how this surgery was going to impact my sex life with my husband. So, this is day 1 after surgery. I don't really need to worry about that for, until after my appointment in a month. So we'll cross that bridge later on. But, I think I sound better today from where the tube was down my throat. It was very raw and irritated. I was a little bit hoarse last night, but I was drinking warm, like tea, and this morning it still felt pretty sore, but the hot coffee seems to have soothed my throat. So anyway, yeah, I'm here. Put on a pot of beans today so they can cook themselves, and I'm just going to try to walk as much as my body will allow, and I just don't want to lay around a whole lot if unless I feel like my body's telling me I need to, because from everything that I know, recovery happens, is a lot easier and happens a lot faster the more active that you are. So I'm going to try to stay as active as possible. I have this, I don't think you can see it. I have this patch behind my ear, and that's to prevent nausea. And they told me if I touch it, it could cause my eyes to dilate. And I think that may have happened. I don't know if they're dilated right now, but I got a little bit of blurry vision going on, and they said that could happen if I touched that patch and then accidentally rubbed my eye. So when I read, it looks a little kind of double, or almost like I need glasses. But so I'm thinking maybe in my sleep or something I touched that and then accidentally touched my eye. So, but yeah, morning after surgery, I guess you'd call it day 2, going into day 2 recovery. So I'm doing okay, and I'm just gonna try to rest and recover and follow doctor's orders, which is going to be really challenging for me because, like I said, I'm not one to sit still and do what I do. So, but here we go. Please feel free, once I post this video, whether it be you watching it on YouTube or just here on Facebook, feel free to comment or message me with any questions or whatever. I'm going to do my best to cover, all the things that come to mind, and like I said, it's different for every woman going through this. I am so thankful that I was able to get the laparoscopic, because that's minimally invasive in comparison to when they open you up like that, and that's much tougher recovery. And I've heard from some women or other women that had family members that went through it, how challenging that could be. But I showered this morning on my own. I didn't need help beyond yesterday to, walk and move or anything like that. I'm going slow, very slow, because like I said, all the pulling and stinging and everything. But I am moving much better than I anticipated. So I'm doing pretty well. I left the door open to the bathroom, and my husband was right there sitting at the dining room table in case I needed him. He just left for work, so it's just me and the dog now. So maybe I can, once my eyes aren't doing what they're doing right now, I might be able to read a book or something. But okay, well, that's all for now. And thank you again for all of the well wishes and prayers and everything. I really appreciate it. And I will talk to everybody in the next one. Have a good day. Bye.